Hi everyone, my name is Suzanne and I'm a Chinese metaphysics master in Hong Kong. Today I'd like to talk about why we need to have date selection for medical procedures, but also when a date selection for a medical procedure is not necessary. So a lot of people think that whatever you do in terms of health, you need to pick an auspicious date to make it work, to make sure that the treatment goes smoothly and that there are no hiccups. And while this is generally true, I would say you don't really need date selection for things like removing a mole or removing an ingrown toenail or having a small mark on your body taken care of, or even a tattoo removal. Things like that, you don't necessarily need date selection because it's unlikely that if things go wrong, you're actually at risk with your life. Yeah. So therefore, for things like that, we don't really recommend date selection that much. But when it comes to important medical procedures, so let's say you're taking out an appendix, or you start chemotherapy or some other long-term treatment that is treating a chronic disease or that is treating something that could potentially be life-threatening, then of course we want to make sure that we start on a good date to ensure maximum success for this procedure. Now, it will not guarantee 100% success, but it does guarantee that it gets off to a smooth start and that you are imbued with the most positive and auspicious energies for this particular procedure. It's also why very often we do look at the date, for example, when we recommend a cesarean birth for a mother. We look at the date to check whether this is actually a good date, not just for the child, but also for the mother. Yeah, we want to make sure that the mother recovers as quickly as possible and without any complications that could otherwise occur. Ideally, and this is not possible very often, but ideally we would also look at the doctor's chart to see whether he clashes with the day that he's actually performing these procedures, because we don't want him to make any mistakes. Yeah, there could be mistakes on or the cause for mistakes could be on the doctor's side, but could also be on your side because you're maybe not healthy enough for a particular procedure, or there's something else that is not in sync with you. But getting the doctor's chart is usually quite difficult, especially in Western countries where date selection is not something that is very popular or common. In Asia, that's easier to get, but still not that easy to ask a doctor to just give them your his or her birth date. Now, again, don't fuss over the small things. Yeah, if it's just a small procedure and you know you're going to be out of the doctor's office in an hour or two, don't worry about it. Yeah, removal of a wart, or even just pulling a tooth or having a cavity filled, you do not need date selection. Only the big stuff that is painful, that is that can take a long time, that is treatment for a long drawn out disease or a potentially lethal disease, then yes, date selection is needed and recommended. And this is then when you get in touch with people like myself, and we then select the best possible date for you to start these types of procedures. So if you would like to know more about this, if you yourself have a particular procedure that you need to undertake and you would like to get a date selection or a recommendation, then get in touch with me. My contact details are in the notes below.